Hey everyone, it is Kevin Henry. I'm the editor-in-chief for drbicuspid.com, and welcome into another edition of the drbicuspid.com podcast. Thrilled today to be talking about a very interesting topic about leadership in this next generation of dentistry, and we'll be doing that with Dr. Rick Valachovic from NYU. Hey, Dr. Valachovic, how are you?
Good, Kevin. How are you?
I am great. Thanks so much for taking the time today. I really appreciate it.
Thanks for having me.
I'd love for our audience to know a little bit more about you before we dive into the topic.
Sure. I'm a pediatric dentist by training, and I'm currently serving as a clinical professor and director of the New York University Dentistry Center for Health Policy and Management here in Manhattan. I then began my career on the faculty at the Harvard School of Dental Medicine, and then I was recruited to serve as the president and CEO of the American Dental Education Association, organization in Washington that represents the dental schools and programs throughout the United States and Canada. I did that for about 22 years and then joined NYU in my current role in 2019.
Very cool. Again, honored to have you on today and honored to talk about a topic that I know is very near and dear to your heart because you published a paper recently, or I should say an article, on NYU's efforts to really build up leadership competencies among dental students and early career dentists.
Right.
What drove you to publish this article?
Well, during the time that I was at the American Dental Education Association, the most compelling issue that I saw facing dentistry for the future was who were going to be the leaders for the future. You know, the students that are graduating this year are going to be practicing for the next 40 years. That puts them into 2065. I mean, if we just look at what's happened in the last few years, that is just transforming the practice of dentistry, the introduction of artificial intelligence and robotics, the rise of private equity and corporate dentistry, remarkable demographic shifts, and increasing societal demands on the profession. So we've got we don't really have a ladder of leaders that are going to succeed us. And so our focus has really been on trying to develop a group of leaders within our dental students and residents, our young faculty who can serve in these roles in the future.
Do you find leadership is viewed differently among this next generation than it is maybe with our generation?
This generation, on top of everything that we've already, talked about with the transformation going on, we know this generation sees things much differently, and the kinds of ways in which they communicate, the way they think, the way that they interact are just so much different. And so we really need to be looking at not just the traditional ways of providing leadership training, but new ways that incorporate the kinds of experiences that these students and young faculty have as we move into the future.
Advocacy was one of the key points that you pushed across in your article. Do you still feel that organized dentistry is as important to this generation as maybe it was to previous ones?
I think that organized dentistry is even more important now. The organized dentistry, in large part over let's just say the last 50 years, was really focused on creating community among the dentists locally, then statewide, and then nationally as well. But we really need to be worried about how we move into the future with organized dentistry providing the basis for the community that we want to be able to present to the public. And so I think that organized dentistry in all of its forms it continues to be amazingly important.
I know you mentioned some of the challenges that are facing this generation of dentists, and we know hiring team members, keeping them is such an important thing. Is that where leadership really plays a big role in keeping those team members and a team together?
Absolutely. When I talk to students, I said, no matter what you do in your career, even if it's just practicing even by yourself with a small staff, you're still expected to be a leader. And in the community, you're going to be expected to be a leader. No matter what community you're in, you're going to be looked on as someone with a great deal of education, interest in health, interested in people. And so you're going to be called upon to be considered for the school board, the city council, the mayor, all the way up to, the president of Pakistan that just completed his term was a dentist. So I think that the issues that we face on top of these things that we just talked about, if we consider there's now 75 dental schools in the United States, up from 56 in 1996. And there's another 5 universities that are considering opening a dental school. So who's going to be the deans? Who's going to be the department chairs? Who's going to be the program directors in all of those? But, in addition, just think of where else the leadership is needed. The U.S. military, with over 2.5 million personnel worldwide, are going to continue to require dental officers to lead at all levels. The growth of more than 1,000 DSOs and larger other group practices has created a pressing need for leadership throughout their organizational frameworks. And not-for-profit dental associations, organized dentistry in the United States also depend on capable leaders to address their unique challenges effectively.
Yeah. During your time at Harvard, during your time at NYU, how have you seen the quest for leadership education come into play, knowing this next generation focuses so much on their clinical skills during dental school?
They do. See, one of the challenges of both developing leadership skills and practice management skills in dental schools is, dental students are under such pressure within 4 years to learn all of this with new technology, adding on to, the kinds of training that my generation had. In 4 years still, there's an expectation that you're going to be ready for unsupervised licensed practice at the end of your time in dental school. So the time in dental school is just so much spent on developing clinical skills and acumen that the other kinds of things that are going to be needed for your professional career, leadership, practice management skills, they're just, they're not ready yet to be in that teaching role. So that's why at NYU, we've introduced this what we call the leadership education portfolio. We have a group of students in each year in what we call the Dental Student Leadership Institute. It engages students to prepare them to tackle the challenges of the future. So we're able to get some of them. We have a global healthcare leaders program. We take a group of students to Washington, D.C., train them in advocacy, and have them meet with members of Congress and their staffs. We have a global leadership program where we take students to NYU's global sites. We've been to Florence, Italy, Prague, Czech Republic. We'll go back to Florence again this year, and then future we expect to go to NYU site in Ghana. We do a mock congressional hearing so that students, again, the issues of advocacy, no matter what you are doing as a leader, you're advocating. You're advocating for whatever community you hope is going to be following you. And so that may be advocating if you're in a dental school for funds on behalf of your programs. If you're in clinical practice, it may be advocating about new compliance issues or regulatory issues locally and federally and so on. So advocacy becomes so important, and that's why we have all these programs. But we've created this portfolio to make that all happen as best we can.
Again, we're on today with Dr. Rick Valachovic from NYU, talking about leadership in early stage and dental students and how we develop that. And Dr. Valachovic, a question, what role does the dental industry itself have in helping develop these leaders and making sure that this next generation feels comfortable getting into that leadership role?
Well, as we talk about how dentistry is in transformation, so much of what this transformation, as it happens, is going to be led by the corporate sector. So much of what's going to happen is going to come out of the laboratories and the businesses that we consider part of our dental corporate world. And so I think that they play an important part. And when I was at the American Dental Education Association, we had the corporate sector on our as an essential component of our organization, and the board director for the corporate council had an equal vote on our board of directors to the board director for deans or the board director for faculties and others. So I think that the corporate sector is going to play a major role as these kinds of things, AI, 3D printing, all of these kinds of things, they're going to be providing a lot of that leadership.
And I know one more thing you discussed in your article was the value of integrity whenever it comes to leadership. How do we build integrity in this next generation and make sure it sticks throughout their career?
Make sure it sticks is so key. We can talk ethics. We can do a whole variety of things to try to inculcate an ethical basis for practice. But it's something that really needs to be led all the time. And organizations like the American College of Dentists, for example, provide a resource and a home for the kinds of ethical training and other kinds of programming to ensure that ethical behavior continues to be part of our profession, so that as we go forward, the public knows and respects the value of dentists and their ethical performance throughout anything that they're doing.
Dr. Valachovic, I want to make sure, is there anything else that we didn't touch upon that you want to make sure people understand about either what NYU is doing or the article that you wrote itself?
Well, I think one of the issues that we're going to face where we're going to need leadership is around this whole fluoridation issue. If we think about it, how did this happen? For 75 years, it was just community water fluoridation was out there. Yes, there were people who were showing concern about it, but 75% of American water supplies about 75% of American water supplies are fluoridated. And now, all of a sudden, there is this controversy, and look what's happening in Florida. 7 communities since November have withdrawn community water fluoridation. When I started my training as a pediatric dentist in Boston, the water supply in the metropolitan Boston area was not fluoridated, and we did quadrant dentistry, over and over again. You get young 6-7-year-olds that would come in. We'd have to extract the first molars because they were carious, as they were erupting. If we go back to where we were with not water fluoridation, we know that whatever procedures we do, if we're doing a simple restoration, you're making changes. And over time, as a child goes through into adulthood, then there are consequences to all of that. Then, you're making changes. You may have to extract teeth. You're doing restorations. And then you get into periodontal, you get into endodontic procedures, you get into extractions, placement of implants. So I think that the one thing that I would really want to emphasize is we need to ensure that the dental profession takes a leadership role in continuing community water fluoridation wherever we can, and to be at every meeting that a town council or a city council or whoever is making the decisions at the local or state level are hearing from us as leaders about the value of community water fluoridation and ensuring that it continues.
Timely thought indeed, Dr. Valachovic. Thank you so much. And absolutely, I'd love for our audience to know, how do they learn more about you, get in touch with you, should they have any questions or want to follow up?
Sure. I'm on the nyu.edu website. It's dental.nyu.edu. Just enter my name. And my email address, if anybody wants to send something to me, is rwv212@nyu.edu. So RWV, Richard W. Valachovic, 212@nyu.edu.
We'll make sure to have that in the show notes as well, so it'll be easy for you to reach out to Dr. Valachovic should you want to follow up. Dr. Valachovic, thank you so much for your time today. I really do.
You're welcome. Thanks, you.
Absolutely. Thanks to all of you who listened to this episode of the DrBicuspid.com podcast. We'll be back soon with another episode. Until then, take care, and we wish you nothing but success.